Hey everyone, thank you for joining this webinar today about peptides. This is a live Q&A or a live webinar. And if you have any questions, comments that pop up, please leave them in the comment section and I'll be sure to answer those as best as I can. But no, again, thank you for joining us today. For those of you who don't know me, my name is Ethan Ducharme. I am a board certified physician assistant and a provider at TrueBody in Cody, Wyoming. I've been in primary care for the last 3 years or so, but I'm now specializing in functional and integrative medicine. Today's talk will be about peptides. This will not be about hype or trends or anything like that. It's about helping you understand what peptides are, how they work, what actually works, and whether this is something you should even be considering. So a little bit about us and about TrueBody. Like I said, we'll be talking about peptides, but peptides are a very small part of a very small part of what we do here at TrueBody. We also focus heavily on hormones, weight loss, gut health, and all of that is with a personalized and root cause approach. And as we will talk about later, in order for peptides to work appropriately, you really need to take a holistic approach and make sure you're not missing anything. And so the current landscape with peptides is all over the place. Peptides seem to be everywhere right now, but unfortunately, most people are doing them wrong. They're following TikTok influencer protocols, purchasing random products online, stacking without a strategy, and they're just simply getting the wrong peptide or wrong dosing for their goal. And there's just so much confusion, a lot more confusion than clarity right now. My goal today is just to simplify this. Try to keep it simple. Talk about what we use here, how they work. By the end of today, by the end of this talk, you should feel clear and not overwhelmed. So simply, what are peptides? And I think the best way to think about them are signaling molecules. They are chains of amino acids that act as signaling molecules in the body. They send a very specific instruction to very specific cells in our body. So in our body, there are 20 unique amino acids, and these amino acids are the building blocks of proteins. So basically, peptides are groups of amino acids, and their different amino acid sequence, length, structure is what allows these peptides to support a very unique function around the body. But we'll talk more about the specific mechanisms. But again, I think what people need to really understand is that peptides don't force our body to change. They guide and support a natural process going on within our body. So peptide signals, they affect so many different things around. They can affect so many different things around the body. And the list on the left is definitely not an exhaustive list, but they will be relevant for the ones that we'll be talking about. But fat loss, metabolism, libido, sleep, energy, recovery, so many different potential benefits that these peptides can offer. And on the right, the list on the right side, again, these peptides are supporting natural processes throughout our body. But there are different things that can interfere and cause these processes to become less productive or efficient over time. And it can be age, it can be stress, lifestyle. Inflammation can also negatively impact different things around the body as well. So it's important to, again, take a holistic approach with these peptides. So briefly, before we talk about what they are, I think it's important to look at what they are not. They are not supplements, vitamins, steroids. They do not replace hormones, and unfortunately, they're not automatically safe or free of side effects. Supplements, vitamins, they definitely have their place, but peptides should not be looked at or treated like supplements. Completely different, and they're very different compounds than steroids. So what they are, again, is a very precise, highly targeted signaling molecule, and these will serve a very specific purpose around our body. So what we're going to talk about today are what I like to refer to as the core peptides. We've done a brief overview of kind of what they are as a whole, but this will start to make a little more sense as we break it down individually into different classes and different types of peptides. These are the peptides we're going to talk about today are the ones that are the most common ones we use at TrueBody. They're the ones we have the best results with and the ones that we are the most comfortable with. So the first category we're going to talk about, or the first class we're going to talk about, are the GLP-1s, which stands for glucagon-like peptide 1 agonists. Examples like semaglutide, tirzepatide. I mean, a lot of people have heard of these, but they might not fully understand the mechanism. The difference between semaglutide and tirzepatide is that tirzepatide works on an additional pathway, but both of these activate the GLP-1 receptor. And what the GLP-1 pathway is, it's a natural gut hormone that gets released after eating, and then that will stimulate a few key mechanisms around the body, like increasing insulin, which will cause blood sugar to come down. It will also decrease glucagon, which will lower how much glucose our liver is putting out. It will decrease and slow down gastric emptying, helping reduce appetite, and also really acting on the brain to reduce hunger and cravings. So again, this hormone is naturally found in the body. What these medications are doing, what these peptides are doing, is that they are mimicking the signal and producing a longer and stronger effect than what our body produces. So the effects, the desired effects that we're looking for with these peptides, weight loss, number one, very, very important or very effective weight loss medications, and when used correctly can provide very consistent fat loss as well. And as I talked about, improving blood sugar control, helping with insulin, and also the food noise and appetite control is these peptides are very effective at that as well. But why is insulin important? Why is blood sugar important? Type 2 diabetes is basically our body's gradual loss to respond to insulin and decrease our blood sugar. So we become insulin resistant, and that can lead to a number of different, not only diabetes, but all other risk factors down the road: heart failure, stroke, heart attack. I mean, all the weight gain, all the things that nobody wants. So who are these peptides for? We use them for a lot of our patients, but they really shine for patients that are struggling with hunger control, portion control, cravings. And by helping our body become more sensitive to insulin, they're very effective at controlling blood sugars. So certainly in diabetics, they have a very positive impact on A1C and blood sugar control. So a lot of different patients can utilize these peptides, but they, as with other peptides that we'll be talking about, they do not replace any of our foundational lifestyle habits. If our diet isn't in check, if our hormones aren't in check, we might not be getting the full effect that we want. But again, these can be very, very effective peptides. The next class that we use quite a bit here at TrueBody are the growth hormone peptides. Examples of these are tesamorelin, ipamorelin, sermorelin, CJC. Those are probably the four most common that we use. So before talking into more detail about these growth hormone peptides, it's important to lay out what growth hormone is and why it's important. Our body naturally releases growth hormone in several different pulses throughout a 24-hour period, and most of these occur at night. Age, lifestyle, and a number of other different factors can cause low growth hormone release. If we have low growth hormone, this can contribute to things like increased body fat, reduced muscle mass, slower recovery. And again, I should have backed up a little bit, but growth hormone leads to the production of a hormone that's called IGF-1. This is actually the hormone that's going around our body, having all the positive downstream effects. But basically, growth hormone is kind of the first step in that process. So what these growth hormone peptides are doing is they are stimulating our body to produce and release more of its own natural growth hormone. They either increase the frequency of the growth hormone pulses and or increasing the amplitude or how much is released every time. So then growth hormone will lead to increased IGF-1, which we briefly talked about. But that will have the effects that we will talk about. I think the two biggest reasons we would use these for would be like tissue growth, repair, recovery, but also body composition. So tissue growth, that could be everything from supporting muscle, bone, organ health, but also the body composition is a very positive effect with these peptides as well. They're helping promote fat breakdown and preserving or helping build lean muscle. And the important thing with these peptides is they really help with the visceral fat breakdown. This is the type of fat that is the most dangerous, the most inflammatory. On the third bullet point talks about metabolism. The more muscle we build, the more muscle we maintain, our metabolism is going to improve, and our glucose regulation will improve as well. But the recovery, performance, sleep, bone density, I mean, a long list of different effects that we can get from these peptides. What I'll hear from patients is that they will often report that their strength in the gym improves, they're able to recover, or less recovery time is needed in between workouts. So when we talk about these peptides, who might benefit from them? Pretty much anybody who's looking to improve sleep, recovery, strength, performance. I mean, I truly believe that anybody can benefit from these peptides if they're being used correctly. But these do need to be monitored. We need to have proper dosing, proper regimen. We need to be checking labs to make sure that growth hormone, IGF-1, the levels are in a good range, but we don't want them too high because that can lead to negative effects down the road. But these peptides can also be a good option for patients who are on a GLP-1 and looking to preserve muscle, build muscle. So they definitely kind of have a wide variety of different effects. Allows us to use them for a lot of different patients depending on what their goal is. There's another peptide I want to talk about. It's called MOTS-c. This one's a little unique. It falls under the body composition and weight loss umbrella, but this is a standalone peptide. It's not a class of peptides like the two previous categories we talked about. This one's unique in that it's what we call a mitochondrial signaling peptide, and it's encoded by our body's mitochondrial DNA, not nuclear DNA. This is what makes it unique. Mitochondria is important because it is the site of energy production for every cell in our body. So this peptide is acting directly on the mitochondria. The best way to think about it is it's a metabolic regulator, and it turns on this AMPK pathway. This is a natural pathway, natural process in our body. This peptide is just amplifying that signal and leading to the desired effects. This pathway, again, it's natural, and it is naturally activated by exercise, fasting, restricting calories. So again, MOTS-c is just helping amplify that signal. So the effects, I mean, the very important effects, very, very positive impacts. It's basically shifting our body toward burning fat instead of storing it. And unfortunately, as we age, our mitochondrial function will decrease and not become less efficient over time. So this peptide is really helping with improving insulin sensitivity, weight loss, energy levels. In quotes, the exercise mimetic, that is used because, again, this pathway on the previous page, this is naturally occurring in our body. But this peptide is just helping stimulate that. So it's kind of mimicking the effects of exercise. But again, it is to support, not replace, weightlifting, cardio, proper diet. It's meant to support all those foundational lifestyle habits that we should already be doing. So, I mean, who's it for? Anybody looking for the desired effects that we talk about above, but I think especially patients who, maybe they're on their weight loss journey and they're hitting a plateau, or we could also add it to, a GLP-1 or a growth hormone peptide, again, just to help more of that mitochondrial function is what we're getting out of this peptide. So the next big category, we've kind of moved out of the body composition and more so into the recovery, tissue repair. These four are probably the most we use. This is a very broad category and a long list of potential benefits, but typically the ones we're using: BPC 157, TB 500, GHK copper, and also some of the growth hormone peptides are very effective at recovery as well. But BPC 157 and TB 500, typically they are stacked together, meaning we use them together, and they are very effective at post-surgery healing, recovery from tendinitis, improving blood flow, tissue remodeling. But they also really, these peptides really stand out with, think of them as like a localized tissue repair, like a small area. They're going to be the most effective at that. GHK copper can help with skin repair, hair growth, kind of stimulating hair follicle growth. The BPC also can be used to help with gut health. It can be paired up with another peptide as a pill form, and can really help with repairing gut lining, repairing or healing from ulcers, leaky gut. So a lot of different, again, broad category, a lot of different effects, but depending on somebody's goal, they are definitely a useful tool to have. So these were, again, some of the most common peptides that we use. BPC, TB500, growth hormone, GLP-1s. They are by far the most common ones that we use here, but they are a small fraction of what is out there. There are many additional peptides that support immune function, inflammation, memory support, libido, sexual health. I just talk about those peptides because they are the ones that Betsy and I have the most experience with, and most importantly, the ones that we were most comfortable with. But again, depending on somebody's goal, there are certainly other peptides out there that we can use. And this goes back to the personalized approach to what we do here at TrueBody. We use a lot of the same peptides, but because they have a lot of different effects, two different patients could be using them for two very different goals. So again, it need to work with a provider who can use that personalized approach and get you the peptide that is going to support peptide or peptides that will support your goal. So for those of you who are currently patients at TrueBody, you will understand kind of our flow. But for those of you who are new, to TrueBody, this is typically what our process looks like. Step one, you'll book what's called the get to know you appointment. And this is a brief appointment where we'll talk about your symptoms, goals, health history, what you're currently taking, and then we'll get labs done, and we'll choose the correct labs based off of that get to know you appointment. And then you'll sit down either with myself or Betsy, and we'll talk about labs, we'll talk about symptoms, and we'll build a customized treatment plan that, again, will look different for every single patient that we see. And then we're going to follow up either 3 months, 6 months, maybe sooner, maybe later, depending on kind of how that appointment went. But the other great thing about TrueBody is that we have a patient portal, and you can message us at any time for question, concern, refills, anything at all. That comes straight to us, and we can get back to you very quickly. So that's kind of how we do things here at TrueBody. So going back to peptides briefly, again, peptides are everywhere, and there's a lot of, you just hear and read a lot of different things. So hopefully I clarified some things a little bit, gave some information, but again, we're just kind of touching on a few of the main ones. But so the truth about peptides, number one, unfortunately, a lot of these peptides can be expensive. Some are more affordable, some can be fairly expensive, but this is why you should know what you're spending your money on, and if you're even using the correct peptide for your goal. And maybe you are using the correct peptide, but make sure we're using it correctly. But the other important thing to understand about peptides is that they are not a magic fix at all. It doesn't matter which category we're talking about or what we're using them for. Peptides work the best when we are building, when we're adding them to a foundation that is strong, and that foundation needs to be lifestyle, hormones, exercise. We need to set a foundation prior to starting any peptides in order for us to get the effect that we want, to make sure we're using our money correctly. So that's another important thing about peptides. But because peptides are really popping up in popularity, there's a lot of different online sources that make it fairly easy to get them. And my advice is to be careful. You need to get them from a pharmacy with strict safety, purity standards to make sure you're actually getting the peptide that's listed on there, and you're not getting any toxins, heavy metals, anything that you don't want. We get our peptides from a pharmacy that we work very closely with, that is meeting the safety and purity standards that we want for our patients. I touched on it briefly, but these different peptides, the dosing regimens are all over the place. Most of them need to be cycled, but their dosing regimen, they're completely different. So again, I think it's easy to get online, get a peptide and start taking it, but you need to make sure you're taking it correctly, safely, and again, supporting the goal that prompted you to start that peptide in the first place. again, going back to foundation, I talk about it a lot, but we talk about it for everything here at TrueBody. I mean, our foundation needs to consist of sleep, diet, exercise, hormones, thyroid, to make sure we're setting our body up, basically putting those peptides into a body that will accept that peptide and be able to use it, the way we want to. I mean, here at TrueBody, we sell peptides, but we don't just sell you a peptide. We build you a plan. Peptides may fall into that plan for some patients. They may not for other patients. So I think I would encourage you to work with a provider who looks at your symptoms, looks at your goals and your labs to make sure that we're building you a plan that is going to set you up for success in 3 months, 3 years, 30 years. And again, peptides may fall into that plan, they may not. So, patients who are currently being seen at TrueBody, you'll understand this, but for patients who are new to TrueBody, our main philosophy here is that we test, we measure, we monitor. We don't guess. There's not a one size fits all cookie cutter approach. We're looking at long-term outcomes, not just selling you, a medication or a supplement or a peptide. Everyone's labs, lifestyle, health goals, and budget are different. And this is where the art of medicine comes in. We are not afraid to tell you no if something is not right for you. And this is true for peptides, hormones, supplements. We want to make sure that we are giving you something that is actually beneficial, that will support long-term goals and not just, a short-term fix or, putting a Band-Aid on symptoms or anything like that. So that is our main philosophy here at TrueBody. So if anybody has any question, concern, comments, feel free to leave that in the chat. Also, we are running a special that if you mention peptides at any time, you get $100 off toward your next labs or visit. And how to book, you can call, you can text us, you can stop in. Let me get that out of here. I already mentioned that about the $100 off. You mentioned peptides, mentioned HRT. But again, we're very easy to get a hold of, very easy to work with. Again, call, text, feel free to stop in. But again, thank you very much for joining me. Thank you very much for your time. Hopefully I offered a little bit of information and education about what peptides are. It's a very, very broad and complex topic. But a lot of different, we see a lot of different patients with a lot of different goals. And again, peptides may fall into that goal. They may not. So I think it's important to work with a provider who's able to take a personalized approach and make sure you are, again, supporting those long-term health outcomes. That's what we're looking for. So thank you again for your time, and I look forward to meeting you if you are new to TrueBody. Thank you.